Hello, I'm Dr. Emiko Sultana, and I congratulate you on your wonderful decision to work as a doctor in the UK. Now, if you have completed your primary medical qualification, such as your MBBS, in a country that is outside the UK, you will have to enter into the pathway by giving your Plab exam. Now, there are other routes, for example, sitting for the membership of Royal College exams, but the Plab route is quite simple, requires less time, and will help you get a training post probably more easily because you will be joining the UK career scale at a much earlier level inside your journey. Now, the first step is to clear your English proficiency test, which the most commonly given one is the IELTS. Once you have a required score in the IELTS, for example, a 7.5 total band score, and a minimum of 7 in each of the sections, speaking, listening, writing, and reading, you are more than qualified to open up your GMC account and register yourself for Plab 1. Now, IELTS is often a struggle for many, but with due practice, with determination that you will definitely be able to complete each of the sections with your own merit, and definitely being accustomed to the pattern, being able to give a sufficient number of mock tests. Once you clear your IELTS, you should be more than confident enough to sit for the Plab exam. Another alternative route that is taken by many students nowadays is the Occupational English Test, or the OET exam. So this is another route that you can take. Either way, once you have your results, you should start by opening your own account on GMC Online. So GMC Online allows you to, first off, they will ask you for a username and password. After that, they will require you to fill in some of the information about yourself. This mainly includes, for example, your date of birth, your gender, and some information about your primary medical qualification. For example, what is the name of the medical school, and is it under the designated list of bodies which are registered in the UK? If by any chances your medical college or university does not fall into this list, you will have to apply for it by a separate email with the GMC. Generally, the time that it requires for it to be inside their medical register varies from a few weeks to a few months, but as long as your medical school meets the required criteria, there is no reason that it is not going to be under their designated bodies. Now, after this, you're going to have to put in some of the details about your medical school. For example, when you started, the date you ended, and when you have received your final certificate. So putting in all of this information and your IELTS results, which include your test form results number, then your scores, the score inside, the total band score, the score inside each individual segment, you are able to book a date for the Plab 1 exam. Generally, the Plab 1 exam costs nearly about $250 US. So although the currency varies here and there, and it is subjected to changes once in every few years, but do keep in mind that it costs nearly around this much. And so after this, first, the most important thing you will have to decide is which venue you're going to give the exam and which date you're going to give the exam. The Plab 1 exam is held in many venues around the world. I gave my exam in Dhaka, Bangladesh, and we have 2 months where the exam is held in the year. One is in March and the other is in November. This varies from country to country, but if you would like a more flexible approach to the dates, if you give the exam in the UK, you get a large number of months and dates that are available for you to give the exam. So if you do have that opportunity, I will definitely encourage you to avail it. Now, if it is not possible for you to move to the UK to give the exam and come back, you should be planning your dates in advance. So which means that as soon as you get your IELTS results, you should or your certificate, you should open your GMC account and book a date right on that day. For centers such as Dhaka, Bangladesh, where there is only one center and is limited to near about 50 to 55 seats, the seats overbook very easily. So it turns out if you want to sit for the November exam, you should be registering near around May or June, because there are many candidates who also sit for the repeat exams, so those who have already had their IELTS cleared. So in that case, please do look out for dates in advance. However, some other countries, for example, India, has a greater number of venues and more seats available. So it is more easy for you to register into a country such as India than it is for you to register in a country like Bangladesh, which has just one venue available. Also, if you do not find a suitable venue at your own country in the date that you require, you can make a short trip. For example, many candidates from Bangladesh go to India, give the exam and come back. It does not require much of stress because it is a neighboring country which doesn't require much time on travel. Now, however, nothing is going to beat planning well in advance so that you can give the exam in the comforts of your own country. Now, preparation about the Plab 1 exam. The Plab 1 exam is a 180-mark exam which is held over a course of 3 hours. The whole exam is based on an SBA structure, which we call single best answer. So 180 questions of multiple choice, usually which has about 5 options, option A, B, C, and D. So you are going to have to decide which is the single best, which means you cannot decide that the answer is both A and B, or neither A, B, C, D, or E, but you will have to decide the single best answer. Once you decide that you want to sit for the Plab 1 exam, you are going to fit a designated date, and once you give the initial payment, they're going to inform you about the date that you will have to be present at the venue. The only document that you're going to need is one for identification. So they give you 2 options. One is taking your passport and the other is taking your driver's license. I would definitely suggest taking your passport is much safer because not all driving license formats are the same. Some candidates also try to opt for a national identification card, but again, as it varies from country to country, it might lead to some hassle inside the exam venue if they are not okay with your national identification card. So in this case, please do try to take your passport to the exam hall as your identification site. Now, how should you prepare for the exam? As the exam is based on their format of question, it is highly advised that you spend an equal ratio of time studying the material and practicing questions which are similar to the format that comes in the Plab 1 exam. So which means that your preparation time should be inside a 1:1, sometimes even a 1:2 ratio of studying and solving questions. So we're first going to talk about what should you study in this exam. In this exam, there is a very limited syllabus which usually ranges from what you already know inside your final primary medical qualification degrees. So for example, when I was finishing my MBBS, we had to go through a multiple array of subjects. For example, neurology, gastroenterology, pediatrics, cardiology. All of these are topics for the Plab 1 exam. So if you give the exam soon after your MBBS, the exam preparation becomes very, very easy because you already have the contents fresh in your mind. However, if you're giving the exam after, let's say, a few years, or even after you've got into some specialty, for instance, let's say you are practicing in the field of surgery, there is a chance that you're going to forget some of the basics of gynecology, or let's say neurology, which is specific to medicine. So in that case, you will have, but it is not as difficult or impossible for you to be able to cover the syllabus. So, and with proper guidelines, you should be able to cover it within a range of around 2 to 3 months. So what are the contents that we go through? 2 of the most popular contents that we study for our Plab 1 exam. One is the Oxford Clinical Handbook of Medicine. Now, the Oxford Clinical Handbook of Medicine tends to update every few years, so it's best that you have the most updated version so that it follows along with the NICE guidelines, which is followed by the GMC exam. Number 2, there is another note called the Sampson's Note, which a lot of students have found great benefit in. Now, both of these books do not require a lot of time investment to study, so even maintaining a part-time job, you should be easily able to complete the syllabus within 2 to 3 month period. When I was preparing for the exam, I was working as a as the intern doctor in my hospital, which is the foundation year equivalent, or as many of you might know as the house job, and I would be working about 12 to 16 hours a day. I would still be able to fit in hours because I would usually go through the material maybe for about 1 to 2 hours a day and still be able to finish it quite easily. There are a wide range of books, as you can see behind me, so they're not really books that will require all day and night to study. For example, the Oxford Clinical Handbook of Medicine. Right now we are using the 10th edition. If you're going through this book, you do not have to memorize every line to line. There are certain areas where the questions come from, and that's all that you'll have to know. The other guide that we use is our Samson's Plab Academy Note. So this provides a chapter-wise direction in which you can use to study each topic at once. Unfortunately, like most of the primary medical qualification exams, just studying is not sufficient for the Plab 1 exam. So alongside, with equal importance, if not more, you will also have to solve questions. Now, luckily, we have a compilation of 1,700 questions compiled by Dr. 𝓕𝓲𝓼𝓪, who has arranged this in such a way that you would be able to get each of the questions which come very commonly inside the Plab 1 exam. During my exam, I have gone through the 1,700 questions a total of 3 times. Going through it 3 times helped me in 2 ways. First of all, I was able to decipher what is the type of question that comes in the Plab 1 exam. Number 2, I was able to think the way that the question requires me to. So which means that even though I have solved many papers based for my primary medical qualification and even other post-graduation degrees, when I was studying the 1,700 questions, I knew exactly the format that would come in my real exam. So I would strongly suggest going through the 1,700 questions, each of the questions once or twice, and it's best if you can go through it 3 times. While you are solving the questions, you'll find out there are a lot of things that are not present inside your notes or which you did not go through with much importance inside your Oxford Clinical Handbook of Medicine. These are the areas which you can use highlighters, post-it notes, stickers in order to make sure you focus on this content during your exam. Now, another important basis for solving questions is the Plab 1 recalls. So there are many groups on Facebook, particularly the Plab 1 groups, who post the recalls from each exam. So it is impossible for a student themselves to remember 180 questions that came in their exam. However, when we have about a large community of, let's say, around maybe 200 to 300 doctors adding in one question after the other, we have almost the entire format of the question. Once you look at this, the recalls, you're going to be able to decipher, am I thinking as required for the Plab 1 exam? Or am I thinking which is required for another exam? So when you solve the recalls, it will help you gain a lot of confidence, and it will also help you know if you're going in the right track. In case you do not think that you're well prepared for the exam, you will have to accustom your studying patterns so that you would be able to solve the questions just as required by the Plab 1 exam. Now, these are definitely important ways of practice, so these are things that you cannot go without if you want to score well in the Plab 1 exam. So once again, the Samson's Note, the Oxford Clinical Handbook of Medicine, the 𝓕𝓼𝓼𝓪's 1,700 questions, and our Plab 1 recalls. Alongside this, if you want an extra edge or to make sure that you do not have a problem with time management, I would also highly recommend that you go through 1 or 2 of the mocks by yourself. If possible, you can go through about 5 to 6, which is what I did before my exam, because I did not want to have all of this content in my mind, but not be able to solve the question because of time management problems. It may seem that 3 hours is a long period of time, but believe me, in the exam, the time flies like anything because the questions are much larger. There will be about 5 to 6 lines or 5 to 6 sentences in each question. You will have to read them quickly and make sure you decipher what is important and what is required for the diagnosis or for the proper management. So if you go through a few of the mocks, you will be able to completely get a hands-on to the time management techniques and hopefully be able to finish your Plab 1 exam with even extra time in your hands. Also, please make sure you do not skip any question in the exam. So for instance, let's say the 2 hours 30 minutes has passed, you don't have any time left, but you have about, let's say, 20 questions left, or let's say it's 2 hours 50 minutes. You have 20 questions left. What should you do now? Randomly, you can fill in all of the bubbles. Why? There is no such thing as negative marking in the Plab 1 exam. Even your random attempt to solve 1 or 2 questions, which is completely based on, let's say, your eeny, meeny, miny, mo, it might still be the 1 or 2 marks that is going to help you pass the exam. Very few candidates so far has said that they have failed the Plab 1 exam for about 30 to 40 marks. Majority of the cases, the pass and fail is differentiated by about 3 to 4 marks. So if you can get those 3 to 4 marks by just randomly filling in bubbles, I would strongly suggest you do that. However, your main approach should be to encounter the whole 180 questions in the 2 hours and 45 minutes so that you have about 15 minutes for thorough revision as well. So after this, after your exam, generally you will feel quite confused. Plab 1 is one of those exams where you don't really know how you did. So you would be thinking, all right, so I wrote that the diagnosis is COPD, but could it have also been bronchiectasis? So you might be leaving your exam like this, and I will probably predict that your next 1 month will not be the most smooth sailing time, because majority of the candidates stepping out of the exams are not confidently able to say that, yes, I will definitely pass. So the only option that we have is to wait for another 4 weeks when our results come out. Your results are going to be available on your GMC online site. So another tab is present at the left-hand corner, which says My Results or My Tests. In My Tests, you will be able to find your results, and it will come as either a pass or a fail. So when you look into it, they'll give you the pass mark. Now, generally, the pass mark varies from somewhere around 110 to 15 all the way till 130. And it varies based on the overall percentile of the candidates giving the exam with you. So in this case, for example, you might have passed the exam in March if you have gotten 115, but in the November exam, let's say it was a little easier, so even if you got 115, you might have still failed the exam. So the way that this works is that they tally it based on the overall percentage of marks that everyone got around the world. Unfortunately, something we have no control over. So all we can do is try our best and hope that the pass mark is below the marks that we have scored or we have attained inside the exam. So after this, you are also going to be told about what you can do next. So if you have passed the Plab 1 exam, congratulations. I will suggest you start working on your business visit visa for the Plab 2 exam as soon as possible and book your Plab 2 seat, decide your academy, and start preparing for that journey as soon as possible. Unfortunately, if you have not passed the Plab 2 exam, what you can do is you can register almost immediately for another session. But I do sincerely hope, and I do believe, if you follow all of this advice, you should be able to pass with flying colors in your first attempt. I wish you all the best of luck. Thank you.